Good evening, everyone. I hope every one of you are doing well at your end and taking care of yourself and your family. In earlier videos, I have discussed about important information related to COVID-19. Uh, the information which I am collecting on the basis of literature or on the experience of some patients. In these videos, I am going to discuss about what informations we know in month of March and what informations we know now on this COVID-19. First is earlier we are assuming that whenever the heat or humidity will increase, this virus will die, but it's not like that. We know there is no effect of heat and humidity on this COVID-19. Earlier, we are saying that mask is required for frontline warriors or when you are in a containment zone. It's not required for everyone, but now we are saying mask is required for everyone to inhibit the transmission of COVID-19. The reason is, as we know, there are various asymptomatic carrier also. So whenever we are going outside the home or when we are doing a public meetings or something where we are dealing with more number of people, so in that case we have to always wear the mask to prevent yourselves and others. Earlier we are focusing on COVID, now we are also focusing on post-COVID conditions. Earlier we are assuming there is a high mortality, high death rate in COVID-19, but now we know there is a low mortality. So it depends upon how we are dealing with the patients, what treatment we are giving. So if we are able to give the treatment to the patients at the right time, we can reduce much more mortality in COVID-19. SpO2 monitors, now it's advisable to purchase this SpO2 monitor. It's not very costly, and this is the monitor which measure the oxygen level of the individual. If your oxygen level is decreased more than 5 when you walk for 5 minutes, so then such type of patients, if they catch the infection, so you have to be immediately transfer that patients to the hospitals and give the treatment as early as possible. No need to wait for 1 or 2 days. What now, if you see in social medias or others platform, you will find many apps are coming, and that mobile apps are saying that by using that mobile app, you can also measure the oxygen level, but these apps are not reliable. Earlier we are saying there is no treatment for COVID-19, but now we know depending upon the conditions of the patients, we can give the treatment. As we know, in COVID-19, inflammation is happened, so we have well-known anti-inflammatory agents. We are using steroids also as anti-inflammatory. If the patient is more susceptible to coagulations, we are using anticoagulants like heparin. There are many drugs which we are giving to the patients as per their requirements. Menstruations, it has been observed that menstruations will decrease the illness of COVID-19. Earlier we are not using any steroids for COVID-19, but now we are giving early low dose steroids. I hope many of you have heard about dexamethasone's positive results of the dexamethasone in COVID-19 patients. So this is also the one of the steroids. Another steroids like prednisolone or other steroids we can also use at low dose, but again it's on the advice of the physicians. Hydroxychloroquine, we are earlier saying that we have to give for everyone hydroxychloroquine, but now we know hydroxychloroquine is results in the death of the patients also, particularly the patients who are suffering from cardiovascular disorder or any other comorbid condition. So we have to use hydroxychloroquine precocely, particularly in a comorbid patients, and we are using for the mild cases. Earlier we are saying there is we are not talking about the pool test, but now we are talking about the pool test. Pooled test, what does it mean? It means if suppose in a family there is a 10 members, so you want to check together whether in this family of 10 members anyone is positive or negative. So in that one, in one test you have to take all the blood samples of the members which are in the families, and then pool these blood samples and do a combined test, and it will tell you about in your family is there any COVID positive or negative cases. So it reduces the cost also. So and it's by one test you can test the 10 or 20 persons. So preliminary, earlier we are saying this COVID-19 is affecting only the respiratory system. Now we know it's a non-preliminary, it's affecting the others organs also, not only the preliminary. As you know, in COVID-19, it may or may not be, you will get a respiratory related problem. Someone will get diarrhea, loss of taste, loss of smells or other symptoms. So that also be the COVID. Earlier we are saying in COVID, if someone catch a COVID-19, so fever must. But now we know fever may or may not be. So if someone is not getting a fever but getting other symptoms, so it doesn't mean that person does not have the COVID. It may have. RT-PCR is a gold standard for the COVID diagnostic. But now we are asking with RT-PCR CT value also. CT values is the values which will tell us about the viral load. What is the viral load in the patients at the first day? What is the viral load in the after 1 week? So if the viral load is decreased, so that means the patient is recovering, or patients have less chances to transmit the infections to others. So CT value is important. More the CT values means less is the viral load. If less is the CT values, that means more the viral load in the patients. So thank you. This is the information which I have compiled. In next video, I will discuss about after post-COVID infections, what will be the symptoms and what the treatment we have to give. Thank you.